Okay, we already talked about that diffuse effect that can happen from a toxic effect from these drugs, but some people, even at therapeutic doses, will get this. So it may cause tremors and a feeling of anxiety, okay? The heart's beating fast, we're feeling overstimulated, the CNS overstimulation, and it can actually cause the heart to go out of balance and beat. That can cause an arrhythmia and a defect in the heartbeat, okay? And those with alpha adrenergic agents can cause a significant rise in blood pressure because
Constriction of blood vessels.
the constriction of the blood vessels, okay? The increased peripheral resistance, that can cause a net increase in blood pressure. So, contraindications of these drugs because of those effects, that if somebody has uncontrolled hypertension, okay, so not everybody with high blood pressure, you can't use epinephrine on, angina, okay, angina pectoris, or hyperthyroidism, okay, because of the stimulation of the alpha and the beta receptors, okay, the heart would further have an increase in blood pressure and work, and arrhythmias or myocardial infarction could happen with people with those problems, okay? You can stimulate those problems to happen. So we want to be careful. So does that mean that we would be completely contraindicated from using any epinephrine with someone with high blood pressure? No. Someone with uncontrolled high blood pressure, undiagnosed high blood pressure, untreated high blood pressure. Okay, someone comes into the clinic and they haven't been to the doctor in 5 or 6 years, and their blood pressure is through the roof. Would we give them epinephrine? No, we refer them for their blood pressure. Yes, Layla?
Would that go for uncontrolled hyperthyroidism?
Yes. Yes.
If it's controlling?
Yes.
Or is it-
Correct. So someone who is properly controlled for thyroid disease, hyperthyroid disease, as well as blood pressure, you can use a restricted amount. We call it the cardiac dose of epinephrine. And when you get into local anesthesia, that will be very, very specific about that. Okay? It wouldn't be completely contraindicated. Okay. So what are the uses of some of the drugs? Well, sometimes we want to use vasoconstriction like we just talked about. Okay? Somebody with anaphylactic shock would be given this drug, and sometimes directly into their heart. Okay, cardiac arrest directly into the heart. Local anesthesia we already talked about, because it vasoconstricts the blood vessels. We get less bleeding, and we also get prolonged action of the local anesthetic, keeping it where we want the tissues to be numb. Okay, hemostasis, same thing. Control of the bleeding. It can be either injected, or there are actually topical agents that can control blood flow in the area, okay? Levonorepinephrine is another type of vasoconstrictor. Some of the local anesthetics that you'll use may have it in there. And phenylephrine in the nasal passages, like with nasal sprays and some actually oral drugs, will decrease congestion by constricting the blood vessels in that area and decrease the mucus secretion as well. Okay, so phenylephrine is a drug that's used for that. Okay. Bronchodilation, just like we talked about. Epinephrine, yes, Layla.
Sorry. The last one you said for the that causes vasoconstrictor on the nose and the vein in here. Is that the one that does that? What is that? Congestion? Not. I don't want to say storm decongestion or something. That after the effect of the dose goes away, something happens. The book talks about something like that.
Maybe
One of the
give me a specific question, and then we can talk about it.
It talks about the one drug that when it does the effect it's supposed to do,
Yep.
but the afterwards effect is like a horse.
Yes, you're talking about rebound congestion.
Rebound.
Yes,
Yeah.
rebound congestion.
Yeah.
Yeah, there are some drugs in particular that are used for nasal congestion, and some people have gotten hooked actually on nose sprays, specifically the nose sprays, and they use them because they can't breathe without them. And when they stop using them, they get the rebound congestion. That can happen. Yeah, there are drugs that are now a little bit more specific that don't cause that, but yes, that's absolutely an effect. Rebound congestion. Yep. I know someone who literally had to go through withdrawal of her because of being hooked on the nose spray because she felt like she couldn't breathe, and it was horrible afterwards. But once the drug got out of her system, it got around. Is that what you were talking about?
Yes.
Yes. Okay. Rebound congestion. Okay. Bronchodilation in acute asthma attacks under medical supervision, epinephrine is still used, okay? acute attacks or anaphylaxis, okay? Remember, it's non-specific, A1, A2, B1, B2, okay? Side effects are significantly increased and need to be watched and controlled, okay? Albuterol, really common. It's the one we have in our emergency kit upstairs. Most of your patients who have asthma, okay, are going to be using an albuterol rescue inhaler. Sound familiar? Some of you may use one already. It is selective to the beta-2 receptors in the lungs, okay? In therapeutic doses, it has minimal cardiac effects. If you keep using it and using it and using it, okay? So someone who's had to use it multiple times in one day, okay, or someone who has exercise-induced asthma and had to use their inhaler over and over again, they may actually get that stimulation, CNS excitation from it, okay? They might be a little bit jittery from it, right? So in higher doses, some of those effects can still happen. So even though therapeutic doses, you get the selective effect. In doses above that, you may get that non-selective effect, because if you give enough of it, it's going to affect the other receptors. So it's almost like they get saturated, if you will. The CNS stimulation, okay, we've heard of ephedrine and ephedra. The common name for the drug that's used, like, actually in China originally, Maflang, okay? It has an amphetamine stimulate type of effect. It used to be used in diet pills. It's actually, they've used it, people that learn how to take, like, over-the-counter drugs and extract things from it have used it to make methamphetamines. Sound familiar? Okay. That's why it's behind the counter, even though it's over the counter. Another one that causes stimulation is methylphenidate, also known as Ritalin, for attention deficit disorder. Okay. And adrenergic actions, or agonists rather, that are specifically CNS stimulators. Again, they can be used for a legitimate purpose, and they can be used for an illegitimate purpose, okay, to get some of those other types of effects that people are looking for, the drug action effect that may not be the therapeutic effect. Big stuff, okay. Remember that the blocking agents now are going to do the opposite of what the agonists do. They're going to be the antagonists, okay? They can use these blockers to block both the alpha and the beta effects. Just the alpha effects, so they're called alpha blockers. Just the beta effects, so they're called beta blockers, okay? And any combination of those, the alpha 1, the alpha 2, the beta 1, the beta 2, okay? This is just a generalization. So drugs can be specific to certain receptors in blocking them. What are the blocking agents used for, okay? The alpha ones, since the alpha adrenergic agents, okay, when we stimulate them, it causes vasoconstriction. Alpha adrenergic blocking agents, okay, would inhibit the vasoconstriction, right? They can also block dilation of the pupils, okay? In Raynaud's syndrome, okay, people have vascular spasm, so it may be used to reduce that. Phentolamine, okay? For high blood pressure, okay, it may be used to decrease that constricting effect on the blood pressure, and one of those is doxycycline. It's just examples of drugs that are used as blockers to specific receptors. Okay. Beta adrenergic blockers, and we're going to talk about this in much more detail when we talk about the cardiovascular drugs, okay? They competitively block the beta receptors, okay, in the adrenergic nervous system, okay? And the generic drugs, the generic name of the drugs usually ends in OL, olols, okay? Propranolol, atenolol, okay? Good to remember these. Beta adrenergic blocking agents often end in olol. The non-selective drugs, right? Non-selective.